Number 9, surgery may help, but it won't fix the cause. You see, abdominal surgery, such as muscle plication, that's sewing the two sides of your abdominal muscles back together, or along with a tummy tuck or a mommy makeover, can only do so much. You see, it can tighten the tissues and bring them back together. You can remove loose fat and skin through surgery, but it won't strengthen your muscles or reconnect those essential pathways that you need to regain full core function. So reconnecting your core, both in a physiological sense of finding and learning how to engage and use those muscles effectively and functionally, along with the emotional mind-body connection for a woman who's not feeling good in and about her body or connected, is still an essential process, surgery or not. So if you're considering surgery for functional or aesthetic reasons or both, I urge you to consult and work in the first instance with a specialist women's health physical therapist, as well as following a dedicated postpartum core restoration program like MUTU System. You see, by educating yourself and retraining your core muscles to work naturally and functionally, you may very well not need surgery. And your specialist physical therapist, she will be able to tell you for sure. So if surgery is still recommended or desired, then the work you've done will put your body in the best possible place to recover and strengthen. Continue with gentle core restoration work post-surgery, and that will increase circulation, aid healing, regain sensitivity, and get you truly strong.